good morning. We're gathered here today on Treaty 6 territory, and I also want to acknowledge the Métis people who share a deep connection with this land. I'm David Shepherd, the Alberta NDP critic for primary care and rural health. I'm joined here today by my colleague Gurinder Brar, the MLA for Calgary-North East, and Chris Galloway, the Executive Director for Friends of Medicare. And we are all here today to stand up for the healthcare rights of all Albertans. Danielle Smith and the UCP government have been relentless in their goal to tear down our public healthcare system. The UCP began by starting a war with doctors during the height of COVID. They wanted them to take a wage cut. The UCP was forced to walk that one back, but the palpable lack of respect this government has for healthcare workers, the system they support, and the Albertans who need their care has indeed caused chaos throughout our healthcare system and heartbreaking challenges for those who work in it and depend on it. Now, Danielle Smith has claimed to Albertans that she wants to fix our healthcare system. But her actions, or lack of action, kind of show otherwise. Danielle Smith promised Albertans that she would fix healthcare in 90 days. Well, that was over a year ago. And it's clear, once again, that Albertans simply cannot trust Danielle Smith and the UCP. Before becoming Premier, Danielle Smith said the province could no longer afford to entirely pay for social programs like health care. She wanted to see a shift towards private individuals, employers, and insurance companies. At the same time, she also mused about health spending accounts, and she's now charged the Minister of Technology and Innovation with the task of exploring, quote, the feasibility of creating Alberta health spending accounts, end quote. And frankly, in her own words, that move was simply a scheme to get Albertans used to the idea of paying more of their health care out of their own pocket. The UCP is not focused on ensuring Albertans have access to care when and where they need it. What they are focused on is their drive to dismantle Alberta's health care system. Albertans deserve better. Albertans deserve a public health care system that is respected, supported, and there for them when they need it. For more, I would like to turn things over to Gurinder.
Thank you, David. I want all Albertans to know that we will be steadfast in our support for healthcare workers. Alberta's public healthcare system and the rights of Albertans to have access to the care they needed, when and where they need it. The Alberta NDP absolutely rejects the idea of privatization of our healthcare system. We believe Albertans deserve equal access to care, regardless of their income. And Albertans know that they cannot trust Danielle Smith with the healthcare system. She continues to threaten Albertans' fundamental right to healthcare and has even mused that Albertans should have to pay a deductible to have a major surgery. She has written a policy paper about making Albertans pay to see a family doctor. She's spoken openly about creating a payment relationship between Albertans and their doctors. She doesn't even blink an eye when she makes those offensive declarations. No Albertan should have to pay to see a family doctor. This summer, a medical clinic in Calgary informed its patients that they would be introducing a plan to charge fees for faster access to its family doctors. Patients who didn't come up with thousands of dollars in fees would end up in the back of the line. We all know under the UCP, the line to see the doctor gets longer every day. That move by the Calgary Clinic undermined the very values of public health system, and public outcry forced the clinic to halt the plan. But that doesn't mean that we won't see something like this tried again, especially with the UCP government that is hell-bent on dismantling public healthcare system. The Alberta NDP will oppose any measure that forces Albertans to pay to see a family doctor. So, later today, to fully protect Albertans' rights to quality healthcare, I intend to introduce legislation to make these practices illegal once and for all. It's a pretty short bill and a simple bill. Bill 201, Alberta Healthcare Insurance Access Fees Amendment Act, will ensure that no Albertan has to pay out of pocket to access healthcare services in Alberta. Dr. David Keegan, a family doctor and a professor of family medicine, Cummings School of Medicine, was not able to attend today, but he did ask me to share this message with you. No Albertan should ever have to pay to see a family doctor. We should have legislation to cement this guarantee and back it up with proper funding to stabilize our health system and focus on prevention and primary care. We cannot trust this UCP government to make this vital commitment to Albertans, but I am hopeful, especially at a time when there is such an unprecedented and damaging shortage of family physicians across Alberta, that they will do the right thing for Albertans and support this important bill. Thank you very much, and now I would like to invite Chris to say a few words.
Great, thank you, Gurinder. I'm pleased to be here today to support this bill on behalf of Friends of Medicare. At Friends of Medicare, we believe in public health care, we're committed to it, and we believe that no Albertan should have to pay to access medical care or to see a family doctor. And for years, we've been pushing for legislation to ensure just that. The incident with Marta Loop in Calgary this summer shows exactly why legislation like this is needed. When thousands per year in fees were proposed, the reaction from Albertans was swift. They opposed this. It was widespread. They were upset. Yet we've seen nothing from Danielle Smith and her government to prevent this from happening again. In fact, her record is one that supports things like paying to access a family doctor, like deductibles for a surgery, like her healthcare spending accounts. You know, at election time, we saw her promise over and over again to Albertans that no one would ever have to pay to see a family doctor. But given the UCP's record on public health care, their push for privatization, I have a hard time believing that promise and those words. We need more than election promises. We need more than public health guarantee gimmicks. We need clear legislation, like Bill 201 that Gurinder has proposed today. We call on all MLAs in the legislature to support this bill. It's a simple bill. It's straightforward. It's an opportunity for Danielle Smith to keep her promise to Albertans and ensure that no one will have to pay to access the medical care that they need. Thank you for giving me a few minutes today, Gurinder and David.
Thank you, Chris, for your staunch advocacy to access to public health care for all Albertans. And we are happy to take questions you might have.
Thank you, everyone. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. Please state your name and outlet and who you would like to direct your question to. Catherine, your line is open.
Or who to direct, perhaps Mr. Brar. So is this bill strictly focused on the issue of memberships and paying to speed up access or get access altogether, or are there other aspects of this bill?
Well, this bill, as I've already mentioned, that this bill is pretty simple and short, and it will completely ban from, it will completely stop for Albertans to pay out of pocket to go see a family doctor. We will not let this happen. That's what this bill intends to do.
Do you have a follow-up? Yep, go ahead, sorry.
Yeah, paying out of pocket to see a family doctor. So, I mean, there's things like parking fees. Sometimes you got to pay parking fees to see a family doctor. Sometimes you see a family doctor and you have to pay to get driver's medical or what have you. And then I was wondering if it includes any of that, or if it's just paying to see specifically. And then I guess I was wondering, I know there's the modernizing the primary care system, and pretty soon nurse practitioners are going to be able to have their own clinics. Does this bill cover nurse practitioners as well, or only family doctors?
Sure. Thing is that this bill, again, will cover the insured services. Alberta Healthcare Insurance Act. According to that act, patients cannot be charged by any clinic to provide insured services, and we will be protecting that. in this bill that no patient or no Albertan has ever to pay out of pocket to go see a family doctor. And on your question to nurse practitioners, we are not there yet. So we'll see what happens when it unfolds, and I'm sure my colleague David Shepherd has to say something about it as well.
Thank you, Gurinder. As Gurinder said, it's basically this bill covers all publicly insured healthcare services. So that would be for any kind of specialist, any kind of family doctor. Anyone that is collecting public services is not able to charge a fee to be able to access those services. So things like parking, those sorts of things, those are everyday costs that we face, to go to the grocery store, that sort of thing. They don't fall under this. There is a clear definition in the Act of what access fees are and what they would constitute. And in terms of nurse practitioners, I understand that they are in conversations with the health minister, and the health minister indicates she is going to have a compensation agreement coming forward in the near future. If they reach a point where they are compensated as a publicly insured health service, then the bill would apply to them as well.
Thank you. We'll just do one more quick pass for questions. A reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. Seeing none, that concludes our press conference for today. Thank you.